Hey everyone, I'm Sebastian and this is Don. We are the locally world famous chiropractors in Costa Mesa, California.
Locally world famous.
In this video, we're going to simplify a very complicated topic that is low back pain and sciatica. At Performance Play Sports Care, we've helped thousands of people with lower back pain, sciatica, and hip pain. Things like sports hernias, pinched nerves, disc herniations can all be helped out as well. It all starts with our simple yet effective approach.
In this video, we are going to be going over 3 different types and categories of low back and sciatica. We're going to do a little bit of a description of maybe possible causes and what the heck is going on anatomically so you guys have a better understanding. Then we're going to show you some things that you can try to see if it does help you at home. We're just going to show you different ways to turn a bad back into a good one.
But before we start, a special note about lower back pain and sciatica. The estimation is that about 3% of lower back and leg pain is from serious underlying conditions. Some of these conditions may be life-threatening or require urgent medical attention. Consult a qualified medical provider to establish a diagnosis and formal plan of attack.
If you do decide to do some of these things that we show you in the video at home on your own, just know that you are assuming risk for that.
While a lot of the exercises we're showing today have very low risk associated with them, just know that one person's medication can be somebody else's poison.
Just know if these exercises don't work for you, there are tons of other exercises that we use. We can just go through the library, contact us. We'd be happy to help you find the right ones for you. Here at Performance Place, our medical staff works with the client as a team approach to gather information and put you into one of these 3 categories.
The 3 basic categories are flexion intolerant back, extension intolerant back, and then leg pain, what a lot of you might call sciatica or radicular symptoms. A flexion intolerant back means your lower back does not like rounding. An extension intolerant back means your back does not like arching, bending backwards, or sitting up straight. Radicular or sciatica types of symptoms means that your leg problem is more intense than your back problem.
This may seem like a really simple way to look at back pain, but establishing what your body likes and doesn't like helps us kind of guide you down a path of what may or may not work for your body when we're choosing exercises and rehab for you.
Here's some examples. A lot of times a flexion intolerant back will actually benefit from running and walking, while an extension intolerant back might not like it. However, an extension intolerant back really might like deep squats.
Flexion intolerant back is by far one of the most common types of low back pain. What this can feel like is muscle spasms, stabbing, or aching in some of these locations here. It can feel worse with forward bending, deadlifts, back squats, box jumps, burpees, prolonged sitting to standing, or putting on your shoes.
Some people actually have symptoms that increase when coughing, sneezing, or bearing down, but this is not everybody. A lot of times things that make these types of cases feel better are walking and bending backwards like you're arching your back. Associated diagnoses are typically lower back disc herniations, injuries or protrusions, as well as vertebral body injuries.
Okay, so now we're gonna grab a model and just kind of show you what a flexion intolerant back may look like and some of those structures that might be causing some of this pain. This is your spine here that we're looking at. This is actually kind of, me from the side here. And what we're gonna really kind of zoom in on is the vertebral bodies, the discs, and the nerves here, okay? And so this is the front side, this is the back side. And when your body does not like flexion or bending forward in this fashion, there can be a lot of stress on the front side of the vertebral bodies and of the discs here that can create some of that achiness, that muscle spasms, some sharp and shooting pain. A lot of times sharp and shooting pain actually more comes from the spinal nerves back here, where the disc material can migrate a little too far. Sometimes on that alone, that can just create some more local discomfort, but sharp and shooting pain kind of down into the leg or maybe glute sort of thing can come from spinal nerve involvement.
Now, Dawn, you seemed kind of nervous showing that spine. Is that because the spine intimidates you?
I just was making sure it wasn't blurry. I was showing the right things. My fingers were just in the way.
Got it, and you did your nail polish?
I did.
So just so you guys know, the structures she's talking about, such as the disc and the body and the nerve and so on, it sounds very scary a lot of times, but generally these things can improve with good structured rehabilitation, and it doesn't require the use of medication, surgery, or injections of any type for a strong majority of the people. Typically what they need is a good structured rehabilitation program, but there's really easy ways to decrease pain associated with this problem as well, and we'll show you one coming up here.
So now we're going to go over kind of one of those exercises that we use in office for people who fit into this category that we notice majority of the time it does help out. So when we're spending too much time in flexion, that rounding position, what we really need to do is just kind of even you out in direction. And so we lay people on the belly here. Sebastian kind of created like a diamond with his hands and just relaxed his head into it. And all I'm going to have him do at first here is actually think about the belly button and where he's feeling that on the floor. I want you to expand your breath into the belly button here. You'll notice his low back is going to rise and fall with this breath. And as you kind of work through this, belly breathing can be harder for some people. This is creating some decompression in this area. So getting the feeling of pushing belly button into the ground is really important in this. If you feel like you got that really easy or you're ready for the next step, it's going to be wide as well. So I put my hands on the side of him here. With his breath, he's going to try to push my hands wide. And so now we're creating even more decompression around the entire spine, not just the front side here.
That feels pretty good.
Yeah?
Yeah.
Awesome. So you'll see what's happening here. You can even look at kind of the curve of his spine. This is quite the opposite of what flexion is. And this is really painful for all of you. Well, let's just spend a little time in the opposite. If that feels good, you're noticing some improvements. What he just did here is kind of propped himself up onto his elbows to create even more of that kind of decompression, maybe even into some extension of the spine.
And so if this is what helps you guys, just know that this is a good way to manage pain. It's not an end-all be-all, and it's not a solution of any type. It's a management of pain system. And so typically what we have to do is we have to get people to improve the resiliency of their spine. And normally a lot of people with bad backs, let's just call them, it's actually not a bad back, it's a weak back. What you have to do is make the back strong again, but it's hard to do that when you're in pain. And that's why something like this pain management strategy can really help out. But if you guys are looking for help, there's a link around the video somewhere. Just click on it and we can help you out. Now let's get on to the extension intolerant back.
An extension intolerant back can be painful in regions like the sacral area, the groin area, SI joint, tailbone. It can feel like tight upper glutes, tight hamstrings, or even tight hip flexors. It can be worse with backwards bending, deadlifts, sometimes prolonged sitting, walking, twisting, or even turning in bed.
Some people notice that the pain they're experiencing actually creeps in towards the end of the day, and in the morning they feel generally pretty good. Sometimes it travels further on down the leg, but really not past the knee. A lot of times these people actually feel better when they put their legs up onto a chair, put a pillow underneath their legs, or pull their knees towards their chest while they're laying on their back. Short walks can help, but a lot of times the further they walk, the worse it gets. Diagnosis associated with this is Facet syndrome, spondylolisthesis, pars fractures, or arthritis.
So we're going to use a model again just to show you some of the structures that can become a little sensitive in the extension intolerant low back. Instead of using the bigger model here, I'm going to take a small one. Really what this is just one chunk out of the low back here, two vertebrae on top of each other with a disc in the middle. Okay, and then I'm going to come a little closer here just to show you what is going on. So again, just to kind of review, vertebral body on the top and on the bottom and the disc in here, but we're gonna kind of flip around. This is the back side. So sometimes you can even feel these if you were to put your hand on your low back. They're the little pointy things back there. So some of the structures that become really sensitive here are facet joints, okay? It's where the top and bottom vertebra come together, the joint that prevents too much extension. So when you're doing that for long periods of time, it can become hypersensitive because you're loading into it too much. Or if you think about the movement of extension, what I'm doing here is that backwards bend. This is what happens in that structure. You're taking away some space of that spinal nerve, okay? And it can create some compression in there as well. And sometimes that is where that referral pain into the tight hip flexors, upper glutes, tight hamstrings, all that's really coming from the nerve that's supplying those muscles there. Some of the more serious things that we were talking about, like a pars fracture or spondylolisthesis, is more of just that facet joint where it all kind of comes together in the vertebral bodies. We can get too much stress through that bone and you start to have fractures through here. Sometimes the fracture becomes so bad that now it can't resist movement and you get slippage happening.
Now, one of the simple pain management strategies we can use for an extension tolerant spine is neutral or flexion. I know it sounds very simple. It is. And so I'm going to have Dawn go into the position now, which is called 90-90 breathing. And I'm going to be basically her couch or her chair. Because you don't need anyone to help you with this. You can just do it at home, okay? And so right now I'm just putting Dawn in the position where her hips and knees are basically in about 90-90, which is why we call it 90-90, okay? Dawn's putting her hands behind her back just to illustrate the point that she has space there. Can you get rid of that space? There you go. And so she's pushing her back against the floor, not like she's trying to break the floor, but she's just trying to secure her back against the floor. Now she's got her hands into the position we had with the last breathing strategy, and she's going to breathe into the same region. Do you have any problems with that position?
Mm-mm.
Good. If she did, I might have her move closer to the object, or in this case, I'll move closer to her, bringing her knees closer to her chest. And then so she should be able to let her back fall even more so against the floor in this position, and breathing should be a little easier, right?
Breathing's a little easier, and I feel like bringing my knees closer to my chest just kind of allows my back to be a little flatter.
Yeah.
Naturally.
Some people notice that the upper glute stuff, the hamstring tightness, the calf stuff, even the sacral issues, that the SI joint pain that they notice actually gets better in this position, and after they get up from it, they feel much better.
Mm-hmm.
Now, this doesn't do anything for necessarily long term. It's, again, a pain management strategy. Just as we mentioned before, if you have any back pain that is from your back being, let's say, bad, typically it's not a bad back, it's a weak back. And so a lot of times people need to just improve the strength of their back to improve the resiliency so they can go back and do what they want to do.
So the way 90-90 breathing works is it creates decompression of your spine. When you think of decompression, maybe your mind goes to hanging upside down, maybe one of those inversion tables, or decompression therapy where you're strapped to something and kind of pulls on you. The thing about that is you need a specific tool to do the work for you, whereas this one here, 90-90 breathing, you can do it on your own wherever you are, maybe with just a couch or a chair that you usually have access to, and it's using your own muscles to decompress. When we learn to breathe full 360 around the spine, it creates decompressive forces in the spine that Sebastian's actually going to get into.
Yep, and for this I like to use usually a can of Coke, but we're going to go with, all I have is peanut butter here. This is pretty simple. We look around the whole thing. There's no magic to it. It has sides on all sides, and it has a bottom side and a top side. Normally when we look at this from an anatomical type of scenario, we have the ab wall, the side, or the obliques they might call them, and then we have the backside, which is your area around your spine, like the QL, the multifidus, and so on. The bottom part is the pelvic diaphragm, which is like your Kegel muscles and pelvic floor. The top part is your thoracic diaphragm, which is the one that most people are familiar with in regards to breathing. What happens when we do good breathing patterns is we take the thoracic diaphragm and the pelvic diaphragm and we almost compress them together. If I compress this thing hard enough, this side, the other sides will bow, and it will bow because inside it is actually liquid and material, which is called your organs. And so the abdominal area is full of a fluid and organ-based system that when you compress it, it will bow out to the sides. And now if we think about this from a spine support perspective, imagine this thing, it's much bigger. Now it's on the front side of my spine, and when it bows, it actually helps support my spine on the front side, and it actually decompresses it from the center. And that's how, ladies and gentlemen, peanut butter works. Now it's important to note that spinal decompression machines don't do that, so this is a little different. Let's get on to radicular and sciatica.
Radicular or sciatic pain can be located in the leg, the calf, the foot, and most of the time these areas are more painful than the back pain. It usually feels worse with bending over, especially with straight knees, hamstring stretching, and driving.
A lot of times people report increase of stiffness or the feeling of tightness into areas like the hamstring, also stabbing, shooting, tingling, and even complete numbness of the leg, the calf, or even parts of the foot. Many people report that they have improvements when they lay flat on their back, flat on their belly, or lay on their back with their knees bent, similar to the last position we just showed. Common diagnosis you'll find associated with this is piriformis syndrome, tight hamstrings, disc herniations or protrusions, or radiculopathy. Now this part confuses people, so pay close attention because your recovery will depend upon it.
So unlike the prior two categories, which were pretty upfront, we know exactly which direction is the directional preference for you, the thing about sciatica or radicular pain is that you can fall into either one of those categories. So we notice a lot of times that people with these types of symptoms, it's really hard for them to find a pattern. They don't know if it's flexion or extension that's creating their symptoms. And most of the time it takes a skilled professional to help them figure out what is the right direction for them.
Now Dawn's going to cover on a model again to show how flexion or extension can create nerve pain.
All right, so we're going to take our little segment model like we did in the past, and we are going to bring it closer here. And really what we're focusing on in radicular pain or nerve pain is this little guy here, okay? So if we're looking at more of a flexion intolerant radicular or sciatica, a lot of times what happens is when we go into flexion, I don't know if this guy is gonna show it today, but if we bend forward or squish hard enough, you'll see that the disc material a lot of times will kind of migrate backwards and push onto this little spinal nerve here. So when he's got too much compression going on, anything supplied by this nerve is going to get really achy, maybe sharp and shooting, or numbness and tingling into those areas. Where on the contrary, if we go into extension, we kind of covered this before, extension, you can even see that spinal nerve is moving, right? So we start to close down space where the nerve needs a little bit of room to move. And again, compression of that nerve in extension over time or too much, or maybe even bony changes in that area, creates a little tourniquet on the nerve, and again, anything supplied by that nerve down into the leg can become achy, sharp and shooting, feel sore, or even numbness and tingling.
The treatment goal with sciatica or radicular pain is to take pressure off of the nerve by any means possible. This does not require surgery, injections, or medications typically, but in some cases it does. Now, a lot of you probably have heard of NCVs, EMGs, nerve tests, MRIs, and so on. To be clear, most of the time, you do not need any of these images or studies performed to start a recovery program. All you really need is a good thorough examination and history-taking process to best identify where a good starting point is.
So usually with these symptoms, we take one of the two exercises that we previously showed, and when we figure out which one of those ones works for you, we pair more challenging exercises to go along with it. Spinal rehab and hip rehab to build up strength and resilience around that area, paired with the right first aid for you, is the approach that we take here. Usually you know which one is right for you because you actually have some lasting effects after performing the exercise. It's one of those things where we use an outcome measure. We try something, we get up, we retest something that was provoking before. Does it feel any different in a positive way? That's how we know that that's the right one for you. And to make those more longer lasting effects is then when we then patch in more challenging exercises to help support around it.
Yeah, a lot of times we find that when people only do the breathing exercises, typically they find a reduction of pain, but they also get very frustrated because in about 15 minutes, all of the problems return. The magic comes in using the hip and spine rehabilitation program as a paired type of effect.
So we covered 3 different types of low back pain and sciatica and which categories you could possibly fall into. You got a better idea of what structurally might be going on with you and maybe a couple of things that you can try to help manage that pain and discomfort. After watching this video, if you would like to work with us so we can help guide you down the right path, you can work with us virtually or in person. We've worked with tons of people virtually and people have had tremendous improvement that way. Or you can work with us in person and we can do the full exam and take you through what is correct for you. If you haven't checked out our website yet, we have tons of online resources and web-based programs as well if you're looking for something a little more self-guided or you want some more information before making a decision.
Great, we'll see you guys next time.